When patients come to my clinic saying, "Doctor, my hair fall is falling out in handfuls," my first question isn't about which oil or shampoo they have switched to. My most critical question is, what exactly happened to you in last 3 months? In medical science, there is a condition called telogen effluvium. It is a phenomena where your hair faces a shock today, but it is actually fallen out exactly 90 days earlier. Today I am going to reveal the 6 medical and life conditions that sign a death warrant for your hair. If your hair fall has started suddenly, this video will give you insight. The telogen checklist. I want you to make a checklist with me. Did any of the following conditions happen to you in the last 3 or 4 months? First one, high grade fever. Did you suffer from dengue, malaria, typhoid or any other high grade fever? Research shows that when body temperature hits 102-103 degree, your hair follicles go into survival mode. Second, major surgery and anesthesia. Did you undergo an operation recently, whether minor or major? General anesthesia is a massive physical stressor that disturb your hair cycle. Third, pregnancy shift. In women, the extreme hair fall exactly 3 to 4 months after the delivery is very common. In this postpartum phase, hormones drop suddenly, pushing thousands of hair into the resting phase. Fourth, crash dieting. If you stopped eating properly to lose weight, and if you are losing something like 5 or 10 kgs in a month, your follicles have entered into starvation mode. Fifth, emotional trauma. The death of a loved one or major changes in your life like sudden career change, setback or divorce or any mental stress. These kind of stressors can lead to release of hormone called cortisol, which attacks your hair bulb directly. Sixth one, new medication. Did you start a new blood pressure medication or heavy course of antibiotics recently? Yes, that sometimes may trigger your hair loss. So this was about the telogen effluvium checklist. Why there is 90-day lag? Let's understand the science behind this thing. Now you might wonder, "Doctor, I had fever in January. So why is this hair falling in April?" Our hair goes through a natural cycle. When our body undergoes massive physical or emotional shock, it enters saving mode. The body decides that growing hair is not a priority. Saving vital organs like heart and brain is more important. At this moment, the hair prematurely exits growing phase, they enter shading or resting phase. The research shows that stress-induced cortisol destroys up to 40% of the hyaluron on your scalp. Think of your hair as a plant, and stress steals the soil. However, the telogen phase lasts approximately 100 days. This means hair is technically dead, but it is still attached to your scalp like a dead leaf or a dry leaf. Once these 3 months are up, then shedding begins. Therefore, today's hair fall is actually due to the things that has happened in past, like your past illness or trauma. So, how do you know if this is just a stress related shedding or it is some kind of genetic permanent hair loss? The first one, hair pull test. If I take a 50 or 60 hairs from your scalp and I just gently pull it, and if I see more than 6 hairs coming out, it indicates active telogen effluvium. The second sign, white bulb. Look at the root of the fallen hair. If you see a tiny white club or bulb, it means that the hair was in telogen stage when it failed. Third one, trichoscopy. At Treatmedlogy Clinic, we use digital microscope to scan the scalp. If we see yellow dots and the diameter of various hair is consistently same across the scalp, we know this is a temporary reversible stress-induced hair loss. The good news is that telogen effluvium is reversible. But that doesn't mean you should just wait. The important thing which you need for hair growth The first one is amino acid recharge. You need specific proteins like L-cysteine, methionine. These are the building blocks of your hairs. Without them, the recovery from telogen effluvium will be very slow. Second thing, ferritin check. For hair growth, your ferritin, which indicates your stored iron level, must be above 70. Level often crash to a large extent after major illness. The third thing, GFC or growth factor concentrate. If hair fall is lasting more than 6 months, it is becoming chronic telogen effluvium. Here at Treatmedlogy Clinic, we use growth factor concentrate treatment. These are the growth factor derived from your own blood that act as a wake-up call for sleeping follicles. It is completely natural treatment and it shows very fast result. Fourth pillar, avoid crash diet. Do not stop eating to lose weight during period of stress. Otherwise, hair fall will double in intensity. Remember, not every hair fall leads to baldness, but ignoring sudden shedding can lead to permanent thinning. If you have faced any of the condition from the checklist we discussed, do not panic. Expert advice taken at the right time can save 100% of your hairs. Stop looking for magic oils on the internet. At Treatmedlogy Clinic, we deliver science-backed results. Comment below and tell me what happened to you in last 3 months. Was it fever, surgery, or diet? Our medical team will analyze your comments. If you want professional diagnosis, check the link in the description to share your details. I am Dr. Major Samiksha Tyagi. Stay connected, take care of your hairs, and we'll see you in the next video.